We're going to have a change of subject, a slight change of pace, I think. So as Amy and Cathy step up to the stage, I'll do their introduction. So Amy is an advanced renal specialist pharmacist, and Cathy is a senior renal specialist and pro-doctoral research fellow at King's College London. And they're talking about symptoms in advanced kidney disease, dialysis and transplantation medications. There's a bit more here. So Amy provides a clinical pharmacy service to the inpatient kidney wards. She's involved with outpatient transplant clinics, provision of education and training, and leads the in-house kidney home delivery service. She also works as part of the Leicestershire and Rutland Chronic Kidney Disease Integrated Care Delivery Programme, and Amy is a member of the Renal Pharmacy Group and is co-chair of their Education and Training subgroup. Cathy is a kidney pharmacist at Wessex Kidney Centre in Portsmouth, and prior to this she worked as a clinical pharmacist for over 20 years and wants to help people to understand their medicines. Her research helps to figure out ways to prevent problems with medicines. Over to you two.
That's a great introduction. Thank you very much.
Yeah, thank you.
I'm Amy. I'm from the Leicester Hospitals.
And I'm Cathy from Portsmouth. And thank you for inviting us to speak here. We're absolutely delighted to discuss with you about symptom control and medicines to control symptoms and transplant medicines. Sorry. Okay. Okay, so first of all, we're both Renal Pharmacy Group members. We're both co-chairs for the Education Training Group. Do that together. And so, first of all, I thought we'd explain, just go through what we're going to cover. So we thought we'd discuss some symptoms, how they can be managed. Just wanted to chat about some of the hidden work managing medicines at home. Think about how we can help, to find out a bit about transplant medicines, and also to share some top tips for managing medicines. However, although we've put this talk together and we're obviously pharmacists that help with medicines, we realise that you're the experts in managing what you're doing at home. So I was going to kick off by talking about controlling symptoms. So I've put up a picture of medicines inside some kidneys, controlling some symptoms. However, what we're going to show is that what we're trying to show is that it's not just about adding more medicines and adding more medicines for symptoms. And then I've put together a slide here just bringing together some of the symptoms. And I think what we're trying to show is that we appreciate that there are many symptoms that people can experience, and really that they can affect every different part of the body. And I think really what we think as well as be a really good idea is that if we could sort of diary down symptoms so that we sort of get a picture of what's going on. So lots of these different symptoms are come and go, and really to sort of map down and get a picture of what's happening for people, and then talk to us about them. Please don't keep some of the symptoms and not share that you've got them, because there are lots of strategies and lots of things that we can do to address them. And then I was just going to go over a little bit more about why some of these symptoms might arise. The kidneys are a very clever organ. We've got the pictures here of obviously the artery in the vein where the blood's going in, and then the ureter where the tube's collecting it. And so as the blood goes in, obviously it's being cleaned by the kidney. Some parts of those blood products are retained back within the blood system, and also the kidneys control the acid in the blood and produce lots of different hormones. And however, though, obviously the symptoms can be more complex than that because it depends on what's made the kidney unhappy. So it could be something, again, it depends if it's diabetes or something wrong with the heart or something inside the kidney or something that was down on the as coming out, as whether that's what the problem is as to why the kidneys are unhappy. So really what we're saying is that although there are lots of symptoms that are associated with it, again, there is lots of different problems as to why these arise. Everyone journeys their own, and although there are lots of similar symptoms, the cause might be different. So whether it is sleepiness, insomnia, the headaches, the muscles, or any of the other ones, the solution's not necessarily the same. It's not the same for that symptom. So then what we have to do is just have a little bit further into, say, for example, that we've got some tiredness or fatigue. So again, for that symptom, it could be that there is anemia for some reason, so the blood count is a bit low, the red blood cells, and that can be for a variety of different reasons. So there could be some bleeding, there could be some problem going on, there could be not enough erythropoietin, the hormone that generates the red blood cells, could be short of iron. So so that could be one problem. The tiredness could be caused by insomnia, it could be caused by itching, again, can have sleep apnea, or it could be caused by restless legs. There's a multitude of different reasons, but if we get a picture of what the problem is, the symptom, then we can start to look and sort of unpick what could be the problem. Then if we go a bit further into one of these, so if we look at the itching, again, then there are, again, some different sort of things that we can look at to sort of try and help with that. So wearing loose clothing, just checking that the washing powders, things like that haven't been changed, being careful with perfumes or particularly sort of dry environments. And then we can put on lots of emollients or moisturisers on the skin, ones that we can get on prescription. Most of those have got paraffin as a base in them, so everyone should just be very careful that they are a fire risk, and be careful with smoking or near naked flames. The itching may be due to a build-up of uremia and the sort of problems with the kidney not working, so it may be that you need more dialysis. But then again, there are lots of medicines that get offered as well to help with itching. So if somebody wants to take a medicine to control it, there are lots of things. So we've got gabapentin. There is pregabalin, which is a similar sort of drug to gabapentin. And we've got the diflycophalin, which is a new product out, which is can be given at the end of dialysis, patients that are receiving hemodialysis. Antidepressants, phosphate binders, and can give some of the antihistamines, and then there is also an option potentially to have some sort of light therapy. There are lots of different treatments that are on offer. And then again, I was just sort of thinking again, I'm trying to bring in some of these other ideas. If you've got restless legs, then again, there are lots of things that we can look at. One of the things is that some medicines can cause restless legs, so it's well worth looking at what medicines people are taking, and just make sure that these aren't making the problem worse, not been newly started. So things like some of the anti-sickness tablets. There's some medicines that we give that control a chemical called dopamine in the brain. They can cause restless legs. Antidepressants that increase another chemical called serotonin, and some of the older antihistamines. They're probably some of the main culprits. And then again, it's things like chocolate, caffeine, smoking, alcohol, and again, insomnia. But then again, we have got treatments that we can use for restless legs. So things like, again, exercise and not sort of relying on what you can do, not relying on medicines. And some thought that some oral iron might help. And then again, we've got lots of different medicines that can be offered. So when we look at the different medicines people are taking, as pharmacists, I tend to divide them into medicines that are treated for current problems or medicines that are being used to prevent problems and to reduce down the risk of something which might happen in the future. So sort of split them into two groups. And then when we think about whether we want to start another medicine, we tend to think about what matters to people, and then we need to talk about it. So if there's a problem, if there's a symptom, or there's something that you want, something that's bothering you, or there's too many medicines, or you're not quite sure what they're on, or what you're taking, or how to take them, or how to organise them, come and talk to us. And then come up with a plan. And we often give people structure and support and help as to how to sort of remember how to take their medicines. It can be in the form of a card, it can be in the form of apps. There are lots of multitude of different ways that we might help with and different strategies to use at home. And then, again, Me and My Medicines is the sort of website and the sort of guidance that's out there. Really, these medicines are for you to help you, and it's really important that you know that it's okay to ask, to understand, and to discuss and to chat about them. And the other thing which I just wanted to introduce to you was this idea of something called a prescribing cascade. And I suppose I've sort of described it a little bit with some of the medicines that I was talking about earlier. But sometimes somebody will say that they've got a symptom and then they get given a medicine. And it'll actually be that medicine and then may cause another symptom. And what we have to be very careful of is that is identified and addressed, and that it's not another medicine isn't just put on top. So sometimes the medicine list can get very long because there's been side effects from medicines which have contributed and added to it. So it's just something to sort of be aware of and to look at, and that's sort of one of our sort of passions and things that we probably spend an awful lot of time doing, is going through and looking and checking people's medicines, finding out what they want to take, finding out how they're managing with their medicines, and to sort of go through and unpick, find out what's important to people and what they want their medicines to do. And my passion, again, is to try and make sure that everybody is on the medicines that are correct for them. Individualised sort of approach. Okay, and over to Amy.
So hello all. So this next section is on medicines after a kidney transplant. So you're probably aware already, but after a kidney transplant, there are lots of swaps and changes to tablets. And this can be really frequent, especially in the first few weeks and months after a transplant. So after a transplant, some medicines can be continued from before, some might be stopped, and some new medicines will be started as well. So it's really important for people to always keep an up-to-date list of all the medicines that they're taking for this reason, just to keep up to speed with them all. So the kidney transplant team at the hospital can provide education, they can teach people about these medicines, support them with how to take them, and they can usually provide a medicines list similar to the one on the slide. Many hospitals also encourage people to start taking their own medicines with support while they're on the ward, and this gives them a chance to get used to the new medicines and feel really comfortable taking them before they go home. And this support doesn't stop on discharge. So after discharge, people that have had a transplant will be followed up in clinic really regularly to begin with, normally 2 or 3 times a week. And at each of those appointments, there is a chance for patients to bring up any questions or concerns that they might have about their tablets. So this might seem like a lot of tablets and a lot of appointments, but one thing to remember is that over time, both the number of appointments and the number of the tablets will go down. So today we only have a limited amount of time, so unfortunately I can't go through in a lot of detail about all the transplant medicines that we'd use kind of individually. But if you would like to learn more about medicines after a transplant, in Leicester we've created some patient information videos. And these are all available on YouTube, and you can access them really simply by zapping that QR code. Or you can search on Google and go on the Leicester Hospital's website on the playlist, and you can access them through there. Or the third way of accessing them is through the NKF website on the transplant medication page. And these videos, so there's some videos about individual medicines that we use after a transplant, but also some kind of general information as well. So, as mentioned, a number of medicines tend to be started after a kidney transplant. But by far the most important medicines that are started are the anti-rejection medicines or the immunosuppressants. So you're probably all aware that we all have the immune system or natural defenses that help to protect our body against things that don't belong to us. So it helps to protect our body, for example, against bugs that can cause infections. And this can be really useful if it is a bug, because of course we don't want to be developing infections if we can help it. But it can also be unhelpful. So the immune system also recognises a kidney transplant as being different from the body. And what the immune system would do is it would very cleverly recognise that the kidney transplant isn't part of the body, and it would attack it, and over time cause damage and stop the kidney transplant from working. So we give anti-rejection medicines that work to lower the body's defences and also to protect the kidney transplant. And these medicines need to be taken regularly and long-term, because otherwise what would happen is the immune system would attack the kidney, it would cause damage to it, and it would stop working. And this is called rejection. So there are quite a lot of anti-rejection medicines on the market. A lot of them are listed on this word cloud here on the slide. Some of them you might be familiar with already, and they can be used for other reasons as well as being anti-rejection drugs. But some of the medicines you might come across are tacrolimus, cyclosporin, sirolimus, mycophenolate, azathioprine, and prednisolone. They're the big ones. And these medicines are all very specialist medicines. They're looked after by the kidney team at the hospital, and only the kidney team at the hospital will make changes to those tablets. Also, because these medicines are so specialist, they tend to be supplied through the hospital rather than them coming through the GP on your repeat prescription. And what each hospital has is they basically have like a recipe or protocol for anti-rejection medicines and for the exact drugs and the doses that we'll use. And this will differ slightly from hospital to hospital. But one thing to always remember is that this can always be tailored to the person as well. So it isn't set in stone. As well as the anti-rejection medicines, people may be started on other medicines after the transplant too. So this will vary from person to person and also from hospital to hospital. But possible medicines that might be started are medicines to reduce the chance of infection. So this could be antibiotics or antiviral medicines. These are normally given short-term, just for a few months after the transplant, just to reduce that risk. May also use medicines to thin the blood. So these are medicines that will just reduce the chance of blood clots after the kidney transplant operation itself. We can also use medicines to protect the stomach. So some of the medicines that we give after a kidney transplant can sometimes be irritating to the stomach. So it's just to cover against that. And then other medicines that may be needed are tablets to control blood pressure and also tablets to control blood sugars as well. And this might be in addition to a whole host of other medicines that people might be taking for other health conditions too. And one thing always to check is, if you're started on a new medicine, make sure that that new medicine is compatible with the medicines that you're already taking. Because not all medicines are compatible. Some medicines will interfere with each other. And this is especially the case with the anti-rejection medicines. So with the anti-rejection medicines, there are some medicines that can interfere with them and either make them work more effectively or make them less effective. So it's always worth asking that question. And that brings me to balancing medications. So it's so important for us to get the balance of medications right. So we know that all medicines can possibly cause side effects, but not everyone gets them. And after a kidney transplant, getting that balance right is particularly important because we want to make sure that we're giving the right combination of medicines to protect the transplant and to keep people well, while at the same time reducing any risk of side effects as well. So after a transplant, people will have the really regular appointments. So each of those appointments, the medicines will be reviewed to make sure that we've got that balance just right for the person. And as Cathy said, it's really important for you as patients and carers to be involved in that decision-making process about the balance of medicines. And this is because all of us will respond to medicines in different ways. We'll have different needs as well. And actually, it's just really important that you talk to us and you tell us if you do have any concerns about your medications. For example, if you're concerned about side effects, or if you're concerned because you're finding it difficult to take a tablet or to remember to take tablets. And this is because there's often something that we can do to help. And this sometimes can be something really simple. So it can be something as simple as just changing the timing of a medicine. So talk to us, and we very much understand that you are the experts when it comes to your health and your medicines. So we want to work in partnership to make sure that you get the best from those medicines. And then we just wanted to finish with some top tips when it comes to medications and appointments. So this is a bit of homework for you. So we'd recommend that you always keep an accurate list of all your medicines. You bring this with you to clinic appointments and you show it to all the healthcare professionals. You can then go through this list with the team when you come to clinic, and you can update it if there are any changes to medicines at all. Try to take medicines regularly as well. This is especially important for some medicines, and particularly with the anti-rejection drugs, because with the anti-rejection medicines, these are needed to be taken regularly to keep the transplant protected. Also, tell us how you're getting on, so particularly if you've got any concerns, so that we can support and help you. Attend appointments so that you can have these conversations, but also if you're finding it tricky to attend appointments, just make sure you talk to us as well, because we may be able to do something to help, by rejigging the timing of an appointment or changing it to another date, or by giving you advice on transport options as well. And we'd also recommend that you bring questions to appointments. So it's so easy. I know when I've been a patient, it's so easy to get into the clinic room and completely forget all the questions that you wanted to ask and suddenly remember in the car when you're on the way home. So make sure you bring that list of questions with you, because it will make sure that you can ask all the questions that you have, and it will also help you to get the most out of your appointments too. And finally, we just wanted to remind you that we as kidney pharmacists and the whole kidney team, we're here to help. So if you have got any concerns, ask us, because there's often something that we can do to support. And that brings us to the end of our presentation. So our contact details are on the slide if you would like to contact us after the presentation. And thank you very much for listening.
So if you'd like to come and join over here, and then Erica and Zach, if you also would like to come back up to the stage. So any questions for the presenters?
Well, so that's a question, but unfortunately, again, a fallacy, can't read what's under what's in blue.
Oh yeah, it's tricky, isn't it? Yeah.
Sorry.
No, that's great. Thank you for the feedback. Yeah.
Well, if it was in yellow, for example, on that black background, we should be able to see it.
Okay.
I've no idea what it says at all. I gather it's probably
Oh yeah.
Yeah.
So it's email addresses. So if any of you would like to contact us, just get in touch and we can give you
Can you read
them.
it out, please, for those who don't?
Yes. So Cathy's email address is Cathy, Cathy.Pogson Pogson. That's at nhs.net. Could you hear that okay? And then my email address is slightly more complicated. So it's Amy, A-M-Y, .s for sugar, .page, as in book page, and that's at UHL, so University Hospitals of Leicester, tr.nhs.uk.
First question.
Hi, I've got the microphone.
Okay.
Right, Michelle from Royal London Hospital, and I'm a transplant patient. And I just wanted to comment on what you were talking about on compatibility with medication. So, although you have your controlled medication, which is, from the hospital, our concern is about additional medication which your GP may prescribe. And as a personal experience, I know your GP is not a specialist, and I had situations where some medications weren't compatible, and that's because I've asked the questions or Googled, and I just wanted to know any additional services and who you can reach out to just to actually double check, because sometimes your GP may say, well, this medication is fine, when actually, when I have checked, it isn't. So some people probably not independent like me or can, actually ask those questions. So is there any kind of help or any kind of centralised number
We often ask GP surgeries to list the transplant medicines on the summary care record, the GP record, so that they're listed on there. So then when they try and prescribe something that interacts with it or isn't compatible, then it will flag to them on their system saying that it's not okay. So we ask them to list it, but say that it's prescribed elsewhere, because they're the ones that know the condition that they're prescribing for. So that should flag, and then they should offer something.
And that should be really good when you have, say, your annual reviews with the GP surgery for your repeat prescription, is just to kind of just to check that those medicines are on the list with a note by them saying they're from the hospital, because we do request it in the letters, but it's good to have that as like follow-up to make sure it's on there.
And also, I know every hospital is different, but I feel like every hospital should have like a review with a renal pharmacist to just briefly go through your medications, and so that you can ask questions or go through anything if it's any medication is bothering you, because sometimes when you have your review with your consultant, sometimes you might not want to bring that up with your doctor, and so I just feel like sometimes it'd be relevant just to do it with a renal pharmacist.
Thank you. Well, I'm putting together some research proposals at the moment, planning to try and bring that into something that we can offer. Out of, I think a lot of hospitals offer it in that acute transplant situation for 6 months or a year afterwards, but I'm trying to see whether we can offer something longer.
Yeah, one thing you can also do is many kidney and transplant teams will often have a pharmacist attached to them as well. So you could ask your team, if you're not aware of that pharmacist already. I know a lot of people probably know your pharmacist already, but if not, if you ask the team, they should be able to kind of pass on any details.
Because I find if you're on hemodialysis or PD, you have more of a connection with the renal pharmacist. And I just feel sometimes when you've had a transplant, you kind of lose touch, and you don't get that contact as you did before.
Thank you.
Next question.
Good afternoon. My name's Chetan. I'm with the West London Kidney Patients Association. My question is based on an observation that I've made, and I just wanted to know, why does a 0.5 milligram Adaport tablet look the same as a 5 milligram Adaport tablet?
Yeah, so unfortunately, that's all kind of down to the manufacturers. So there is a very slight colour difference between the two, But I know it's not always easy to see that difference. And we have had people accidentally take the wrong doses of them before.
It would certainly impact people with visual impairments.
Perhaps we could put in another alert, couldn't we? We could put something into the regulators saying that it's a problem if that's something which you would want
is this
us to
common
do.
amongst?
I've known patients where that's happened.
Is this common with all medications of different dosages?
There's another tablet that we used in the blood, which some people may have heard of, with warfarin, and that's again is another similar thing where there is a 0.5 and a 5, where we've had to put in some very careful measures.
And logically, a 0.5 would be half the size of a 1 milligram tablet, wouldn't it?
Yep. Okay, thank you.
Thank you.
Hello, thank you for the presentation. My name is Sumaya. I'm a kidney transplant patient and I am NKF trustee. I just want to ask if there is any help for GPs in terms of transplant patient health issue they can have related to transplant medication. Like I had an itchy leg that lasted, thanks to COVID too, lasted for 3 years and a half. That prevented me from good sleep, they tried a lot of cream, all sorts. Once I brought it to my renal team, I didn't share with them. I thought maybe it's not something that they can help with. But in one discussion, just I mentioned it, and he said to me, "Why you didn't tell me?" He's prescribed a cream after basically a week and a half. All the drama that I lived for 3 years gone, and my GP weren't aware about that specific cream. Again, hair loss, high prolactin that can be caused by prednisolone, all those stuff. Most of the GP are not aware, maybe just my GP, but I had few conversations with other patients where the GP don't have a clue on that kind of thing, and they can just keep giving you the wrong medication or put you on referral that can take 6 months or 8 months when the renal can really speed up and have answers. And sorry, that it's unfortunately in a hospital, the renal works separately than the other. It's they're not looking at the body as a whole. Every sickness or even symptoms is treated separately. I know you can't sort that, and I'm not asking that question. Just going back to the GPs, if there is any training or any work that the renal pharmacist or something that can be done to support GPs on providing them all those information when it comes to kidney transplant issue or side effects from the medication that we are taking. Thank you.
One thing that is improving is the links between hospitals and also GPs at the moment. So a lot of work is being done on kind of joining up care to make sure that there aren't those gaps between the GP and also from the hospital. And it also means that there's two-way communication. So the hospital can hand over any information about your care that's relevant to the GP, but also the GP can come back to the specialist as well. So if there is something that could be related to the kidney disease, they can also kind of directly ask a question to the team as well. So that is one option, is that they could directly just kind of link in with the team. There are some kind of national documents available as well relating to kidney disease, but a lot of the time things are so specific to the person that it's almost better for the GP to have that kind of two-way communication with the hospital. Would you say?
Yeah, something's not resolving and ask for...
Yeah, because sometimes there might be something more unusual that is related to the kidney disease as well.
Okay. One final question. Last question of the conference, so no pressure.
Shashi Verma from Buckinghamshire. I'm a CKD patient waiting for transplant. Not so much a question, but a good suggestion. based on what you said about asking questions. So and this is probably for everyone here as well. So when I was first diagnosed, they used to do my blood test every 2 months, and then on the day they would do the check. But I got my nephrologist to change that to do the blood test a week before, so that we have time to then analyze it, and I get the result myself beforehand, and I send the questions in to the nephrologist before, so they have, they know exactly what we need to talk about, and it's much, much more efficient. As way of that, also was able to then track down a reaction to one of the medication, which caused eczema everywhere. And when the nephrologist stopped it, it improved. So I think I like your suggestion.
That sounds like a great idea. Yeah. And especially if you haven't already, to get access to Patients Knows Best, so that you're able to kind of view your own blood test results, because it also means that you can sometimes see those ahead of appointment and kind of keep track of your own blood tests and your own medicines as well.
Okay.
Quickly, just to understand your medications and what it has, when you looking at your results, because when you get your results on Patients Know Best, you don't know whether you've the threshold or whether it's up or down or something like that. Yeah. So sorry. No, but for me, I don't understand the numbers and what it should be, if you know what I mean.
So you could...
Right, okay. Okay, thank you.
Sometimes with ranges, some people's results might always run a little bit out of range. So if you're not sure what results are normal for you, have a chat with the team as well, and they'll be able to explain the blood test results in a bit more detail too.
Because she smiled so nicely, we're going to squeeze in one more question. Can we get, what we need on the microphone for recording. Oh, sister of Patricia.
Oh, yeah.
My goodness.
Yeah. We've adopted each other.
Just
a quick question, really, to Zach and Erica. I don't want to talk about pharmacy stuff, but, obviously the positive aspects of transplant, obviously there's some benefits, but what else for you guys? What has been really positive in terms of your journey since, Zach and Erica, since you've had your transplant? Just really wanted to find out, and I thought it's a nice way to end the conference.
Me, as a parent, and looking at Zach's journey, he's now learning to drive. His dream job is listening to him for the last few years has been wanting to work at Starbucks, and he's now got a job at Starbucks. He's going to college.
Thank you very much.
He's now back doing swimming. I mean, as soon as he had his line out, it was, can you phone him and see when I can go back? And, it's seeing all that, and you've even got, can I show everyone quickly? Your medal?
Oh, I was going to say, I've got...
He took part in the British Transplant Games just gone, and he fidget toys everywhere. Can you tell him what that was for?
I participated in the Transplant Games, obviously this year, because obviously it's the first one I could do. And I got a gold in the 25-metre front crawl.
And if that's not a good note to finish on, I don't know what is. So, round of applause one more time for our presenters. Absolutely fabulous. A couple of very quick announcements before you all leave. For those who are attending the council meeting, we'll make sure we have a good 10-minute comfort break before we start, and that's taking place in the Derby room, I think it is, next door. What a fabulous day. I hope you agree. We're such a collection of great speakers and information. I hope you've met new people, learnt a bit, shared a bit. It's what this patient event is all about, and I've spoken to as many of you as I can, and I've been saying that this patient event has a different feel to it, and I hope you've sensed that. With respect to our professional colleagues, this is our event. and I hope you've enjoyed it, got lots from it, and we'll tell everybody about it and come back next year. So thank you, everybody. I'll close the session.